My name is Lesley Aitkenhead, and I was a volunteer on the Peer Support Evaluation Project run by Stirling University. I found out about the project from a post on LinkedIn. I wanted to get involved as a family carer for my mother who was diagnosed with vascular dementia over 15 years ago. I also run a small community peer support group and was interested to hear about other peer support groups. I have experience in project and risk management and have also conducted many audits and evaluation reviews within the financial services industry. So I was keen to understand how evaluation is undertaken in the charity sector. The research team encouraged the volunteers to get involved in a way that worked for them, allowing us to balance the project with other commitments. I was delighted to be involved in many different aspects of the project. It gave me the opportunity to share my skills and personal experience, but also to benefit from learning research techniques and working closely with the team. I helped with project planning and reporting, developing creative tools and materials, analysis of interviews, and contributing to the dissemination of the findings. Well, I don't think it's going to be a surprise to anyone that peer support groups are beneficial to everyone involved. They're designed to address gaps in health and social care, and the benefits are well documented. The work of all the peer support groups was hugely beneficial, and the benefits went beyond people living with dementia, including the volunteers and the local community. For me, one of the most interesting areas of the project was how we measure the benefits. Each of the projects operated differently. This is an area of real interest, particularly as a carer and as someone involved in a small charity and as a board trustee. We know that funders will always be looking for ways that charities can demonstrate the benefit of their services. But how do you measure something like peer support? Well, the research project used a mixed method approach to evaluating, recognising that some benefits are less visible and only captured through interaction with members of the group. The area that I found the most interesting with a financial background was the social return on investment. It was used to assess the financial benefit of the groups. For every £1 invested, what was the direct or indirect financial benefit? This was interesting as it highlighted the challenges in capturing this type of data and included many caveats. It was far from perfect, but it gave some useful insight into how benefits can be measured and what data charities need to think about capturing in order to really sell their value. This highlighted the need to find a more holistic way of measuring benefits, rather than trying to find things that can be easily counted. How many members? How many volunteers? That doesn't equate to how much value you provide. I felt the project team benefited from using volunteers. Although I wouldn't refer to myself as older, I think it gave a different perspective. I know from working in the private sector that there's a lot of overlap in methods of evaluation, but involving your customers, getting different stakeholder input helps you to look at things differently, working as critical friends. One example was the videos and reports. The volunteers and community researchers helped to give a different perspective, an audience perspective, which I think helped the outputs be more engaging and less academic. The evaluation was clearly impacted by COVID, and the team had to find a different way to engage with peer support groups. I felt this was managed very successfully, as the project considered a number of different ways of engaging with stakeholders. However, as a volunteer, I would have liked to be more connected with the groups, to meet them in person and talk about their experiences. But I recognised that due to restrictions, the online approach was the only option. Key learnings for me were around the need to find a more holistic way of resourcing projects and measuring the benefits. I feel that funders should take more responsibility for building relationships with their projects and understanding the challenges and aspirations. I think this will help develop a longer and more sustainable funding strategy.